Receiving a cancer diagnosis can be hard enough. A lot of parents then have a lot of questions on how to talk to their kids about their diagnosis. So today, we are talking about parenting through the tough stuff, how to talk to your kids about cancer. This presentation is put together in collaboration with Crossroads for Hope, a network of cancer support, and Summit Health Cares. Hi, my name is Rachel Warner. I'm one of the certified child life specialists at Crossroads for Hope, a network of cancer support. I'm here today to give you some tips and tricks for how to talk to your kids or other kids in your life about a cancer diagnosis. I want to start by saying that I know this conversation can be difficult or overwhelming for some, and if you find yourself in need of continued conversation or further one-on-one support, please don't hesitate to reach out to your existing support team, the Resource Center team at Summit Health Cares, or contact us at Crossroads for Hope. I'll share all of our contact information at the end of the video. In addition, I also want to say that while everything I talk about today is based in research and what we know about child development, you continue to know your children best, regardless of any circumstances that are taking place in your life right now, or whether cancer is a new or continued stressor. Everything that I say can be adapted to fit your family, so I really encourage you to take everything as a suggestion. There are no rules. Thank you for joining me. I will start by saying that it is completely normal to feel hesitant to share news of a cancer diagnosis with children, or be unsure about how to approach the conversation. For many reasons, a common instinct is to protect children from cancer, and that is always done out of love and care. However, what we do know is that for children, the old saying that knowledge is power really holds true. So let's start by considering why it is helpful for children to feel informed. First, as you likely know, kids are incredibly perceptive, observant, and curious, and you, as their family members, are people that they're always watching. Even at incredibly young ages, kids can often tell when something has changed, even if it hasn't been spoken about. Because children are often looking to the adults in the room for guidance, they catch on quickly to emotions, whispers, and changes in behavior. If children sense a change and they're not informed, they often come up with an idea in their head of what's happening, and it may be completely untrue. Including children in conversations about cancer can build trust and help provide the correct information for them to build their understanding on. This gives them an opportunity to be involved in the understanding, and as cancer conversations continue, both with you and with others. Just as equally important, keeping a secret about a diagnosis with children can cause even more stress for parents, because there's always a risk of information being overheard or even shared with your child by someone else without any intention of harm. If this happens, kids may be hesitant to come to their parents with questions or worries. So, if you have an open conversation with your children, it allows you to build the conversation from the ground up, and they can look to you to shape the idea of what cancer means for you and your family specifically, in the same way that you have taught them so many concepts throughout their life. Children may also need new coping tools to deal with changes in routine, family norms, or handle other family emotions that come up. This gives you a great opportunity to work together with them to build healthy coping mechanisms specific to what your needs are at the time. One example is including them in the routine of appointments and treatments and normalizing for them that it's okay for them to know where you are. This helps prepare them to know what they can expect. One way to do this is to keep a calendar or routine on the fridge or somewhere else where your family spends a lot of time. This would help them know ahead of time if, for example, you are not able to drive them to school on Wednesdays because you have treatment in the morning, or someone else might pick them up from soccer on Thursdays, etc. In addition, these conversations give a great opportunity for parents to engage in something called modeling, which is just what it sounds, leading by example. By showing kids that it's okay to have and display emotions and okay to open hard conversations, it allows them the permission to do the same with you when that's needed. Emotions and feelings are normal, and all people have them, but kids have less coping skills built up on how to manage them. Modeling and naming emotions in these conversations can teach kids that it's safe for them to come to you when they are experiencing big emotions and need help managing them. So, before we think about what we might want to say in the conversation with your kids, you want to consider how you can prepare yourself to ensure that you go in feeling as comfortable and confident as possible. The first piece of that is thinking about what your child's previous experiences to cancer may be. And you might know them and you might also not know them. For example, if your child is in school and they're talking about cancer in class, or they have a friend who has an experience with cancer that's spoken about it, you might not know, and that's okay. But you do want to consider what experiences you do know, and that way you can tie them together in the conversation and connect any similarities or differences with your own experience. You also want to prepare for how they may react, and this preparation is more for you than for them. Many parents tell me that they were alarmed when their child started playing in the middle of a conversation like this, and for a young school-age child or a preschooler, this is completely normal and actually how children process and cope. So that's something that you might want to prepare for yourself, that the conversation might not look exactly as you plan, and you can think about in your head and prepare for as perfect of a conversation as possible with your kids, and it may not look that way. So I want to make sure that you are prepared. For reference, it is really common for preschoolers and young school-age children to kind of get up in the middle of a conversation like this and feel the need to roam, because children need movement and play in order to process what they're hearing. It doesn't mean that it's not being absorbed. On the other side, teenagers often need solitude and quiet space to process after their shared information. So they may say, I'm going to my room, and shut the door for the rest of the day or the night. And that's completely normal and typical. And while it may feel alarming, it is developmentally appropriate for them. So just something for you to think about. In addition, you want to think about where you might want to have the conversation. This looks different for every family, so I can't give you a one-size-fits-all answer. But what I do consider you think about is, where are the safe spaces for your family? May you gather for dinner at the table every night together, or do you sit on the back porch and drink coffee in the morning as a family? And I would suggest that you use spaces that are not those safe spaces to have conversations like this, so that you can then return to your safe spaces in your norm together. So that's something to think about as well. I do encourage you to think about having the conversation, whether you might want to have the conversation with, if you have multiple kids, them together or separate. I encourage you to have the conversation in a similar time frame, so that you don't have one child who has information without the other knowing. So that's something to think about as well, and might come into play in terms of where you might have the conversation, just in terms of when you're spending time with each of your children. And the last thing is, when is the right time? So I really encourage parents, when they're getting ready to share the news of a diagnosis with their children, to have a couple of things in mind. The first one is, what is is there a treatment plan determined? Part of this is because you want to give your children concrete next steps, even if that is, I'm going for another scan next week, and then I'm going to find out what medicine I'm going to start taking. So just so that you have an idea of what the next steps are, so that you can share that with your kids. The next is to take care of you. The old saying of, or the metaphor of, putting your own oxygen mask on before you put your children's on the plane is the same metaphor here. So I encourage this for a couple of reasons. You don't want to be having this conversation or sharing the news for the first time when you're sharing it with your kids. Talk to your people, talk to the trusted adults in your life, whether that be a partner, a family member, a friend. Talk about your feelings and ensure that you're able to express how you're feeling, so that you can then hold the space for your kids when the time comes. The next is decide how much you want to share. So this will really depend on your child, your relationship with your child, and your child's baseline need for information. Some children simply need more information to process and cope than other children do. So you know your child best in this scenario, and you always have the option to start small and continue adding information as needed. The next is you want to prepare for questions so that you go in and you feel like you have a solid idea of what you want to make sure you're sharing. We do have some frequently asked questions by children on the next slide, or on in one of the following slides. You also want to consider what may change for them. Something that children will always be concerned about is how this is affecting them, and you want to make sure to give them the awareness and information that they need to cope. So will that look like somebody else picking them up from soccer practice? Will that look like you not being able to come to their class lunches anymore, or really anything? In addition, you want to make sure that you're considering what they may experience. So even if that means you're having a port placed and they'll see your scar, you want to make sure that they're aware of that. Excuse me. Next, you want to think about how they can help. So children want to make sure that they are cared for, and they also want to contribute and have a job towards helping oftentimes. So that can look anything, that will look different based on ages, of course, but it could look anything like, can you help me take out the garbage on Monday nights? Or can you draw a picture for me to bring to my doctor's appointments with me? Can you make a playlist for me to listen to at chemo? So all of those things are just options, and you'll have to kind of work with your child to determine what they feel and you feel is the best way for them to help. Next, you want to consider what else is going on in their lives. So is there a big exam coming up in a couple of days that you might want to wait until right after to share the news? Do they have a big birthday coming up? What is easily navigatable? What is easy to navigate around, and what is not? So you want to make sure that if something is going to happen that they are going to experience. So for example, if you're going for your first treatment and you're not going to feel well, and you want to make sure that they're aware. If you're going for a procedure and you won't see them at night one night, or you won't see them in the morning, you want to make sure to share that news with them. But if there is the option to navigate around some of those big events, you might want to consider doing that. And the last is, I really suggest picking a time when there's not any commitments, kind of right following the conversation, or right leading up to the conversation, so that they have the time and space, and you have the time and space as a family to process as needed. So an easy example of this is if you have the opportunity to share, say, on a Saturday morning and you don't have any plans for the rest of the day. That way you can spend time as a family as needed. They can have alone time to process if needed. They can lean on any friends or resources as needed. So those are all just things you want to make sure you're considering. The last thing I'll say is you want to consider who you are comfortable with them sharing the information with, and talking with them about who they want to share the information with. This is something you want to make sure to do kind of up front, so that they don't feel like they're keeping a secret if they don't need to be. I encourage kind of working together as a team to talk about who might be most important for them to talk to, and who might be most relevant as a support system to them. And then you can decide how to move forward together. So now that we've talked about the why, the when, and the where, it's time to talk about the how. And a lot of parents come to me and share that they don't know how to explain cancer to their children. And my response is usually that we want to make it simple. So we want to talk about what kids need to know in the simplest language that we can. The first step of that is using the word cancer and potentially your specific diagnosis as well. This will help give a name to what is happening with you and your body, and what's happening in your child's experiences, and it will help them cope. So beyond that, we want to make sure these couple of points are covered when we're talking about cancer, because these are things that will come up with kids often, or be concerns of children's often. First, we want to make sure that they know cancer is not contagious. This is specifically because a lot of children's experience is with contagious illness. So we want to make sure to connect that cancer is not like that, so that they are not concerned that they're going to catch cancer. We also want to make sure that they know that cancer is not anyone's fault. So we want to make sure that a lot of times children's need a cause and effect. So we want to make sure that they know that nothing that they did or you did caused cancer to happen. And we also want to make sure that you're talking about treatment plan or next steps so that you can prepare them for what they should expect moving forward. Beyond that, we want to start with the foundation and move forward. It's really helpful to ask questions so that we can gauge kids' understandings. So starting with something like, Mommy hasn't been feeling so great, and she went to the doctor yesterday and they found out that she has this sickness called cancer. Have you ever heard of cancer? And that can help kind of frame the conversation from there. You can talk about how cancer is a sickness that's not contagious like the flu or like COVID-19. And it's no one's fault that it happened. It's not your fault or mommy's fault. In fact, the doctors often don't know why cancer happens. And then you can move into what cancer actually is. So cancer happens when cells in the body, do you know what cells are? Cells are tiny building blocks that make up the whole entire body. They're so small we can't even see them. And cancer happens when those building blocks grow in a way that they're not supposed to. So that's a really simple explanation of cancer, of course. And you want to make sure if your child is asking questions like where in your body is cancer, that you're prepared to share that with them. And then you can move forward and say, Mommy's working with her doctor, all of the doctors, and they're coming up with a plan to give her medicine that she needs to make her body better. And you can start there. It's really as simple as that. You may not even have to go into the explanation of what cancer is in the body at this moment. What kids really need to know is that Mommy is sick, you're not going to get it, and you didn't make it happen, and this is what's going to happen to make Mommy better. So that's foundations of cancer. Cancer 101 for kids is really the beginning of the conversation. In order to help you have some of those conversations, I've added some resources at the bottom of this page. These are two of my favorite books in describing cancer. They actually use the same example that I just used of cells being building blocks. So if you wanted to use them in tandem with each other, you can. I really like these because they're resources that kids can go back to and continue conversations as needed. And they also explain cancer in really developmentally appropriate terms, and also give kind of some context around what other conversations about cancer might look like, so that should you need to continue those conversations, you have the resources ready. As I mentioned earlier, I wanted to make sure that to give you some frequently asked questions by children so that you feel prepared going into the conversation. It doesn't mean they'll come up, but just in case they do, I want to make sure you have the tools you need to answer the questions in an informed way. The first question is, am I going to get cancer? And this is a great time to reiterate that cancer is not contagious, so they cannot catch it from you, and most people don't get cancer. The next one is, who's going to drive me to soccer practice? This is an example of a child's taking your experience and turning it to how it's going to affect them. So a great way to answer this might be, I would love to continue driving you to soccer practice, and if I can't drive you, I'll let you know who is going to drive you so that you're aware. Or, I have treatment on Mondays, so I can't drive you to soccer practice on Mondays, but I'll let you know who's going to drive you once I figure it out. Did you get cancer because I didn't clean my room? This is another example, as I mentioned earlier, of a child placing blame on themselves. So we want to make sure that they know that nothing that they did caused cancer and nothing that you did caused cancer. And most of the time, doctors don't know why cancer happens. So we want to make sure that they know it's not their fault. The next one is, does it hurt? So this is a great opportunity for you to be honest with your children and share if you are in pain or if you are not feeling well. And they're asking this question because they need the answer. So one way to answer this is, sometimes my hip is hurting me and that's why I actually went to the doctor to get checked out. Something that helps is a heating pad. Do you think you can grab the heating pad from the other room? And that's a way that they know that they can help, and one way that you're telling them actually what's happening. The last question is one that no parent wants to receive. It is, will you die? So one thing we want to think about when a child asks this question is why they're asking this question, because it likely is from previous experience or awareness of someone dying from cancer. And one way to answer this question is to connect that experience or ask why they're asking the question, or if they know someone that died from cancer. Because we want to make sure that we're, again, kind of making sure that we're making connections or dispelling any miscommunication or misunderstanding about cancer. But we also want to balance reality and hope. So we want to say, you can say, it's true, some people with cancer do die. However, I have a whole team of doctors that's working to make me better. And there are a lot of treatment options for me to help me make sure that my body gets better. So at the moment, I'm doing really well. And that's a great way to continue a conversation, and something you want to kind of keep an ear out for, because that does share a little bit of concern from the child. So we want to make sure that we're kind of answering that concern. Again, if you need any support in answering any of these questions, or you don't know any of the answers to the questions that your kids asked, it's okay. It's totally okay to tell your kids that you don't know the answer to their question. Sometimes kids will ask questions that you don't necessarily know and you want to take to your doctor to ask, and you can tell them that. So something like, I don't know the answer to that, but my doctor's name is Dr. John, and I'm going to go see Dr. John on Tuesday. Can we write down that question together so I can bring it to him? And that way your child knows that you heard them and you're going to get them an answer. And then it's a great way to continue that conversation when you do get that answer, and you can follow up with them. So now that you've had the initial conversation with your children, what can you expect and how can you help them cope? So as we spoke about earlier, this is likely the first of many conversations that you'll have with your children, and I encourage you to continue sharing your feelings and your experiences with them so that it opens the door for them to do the same with you. I also encourage you to keep routine as much as possible. So as we know, children thrive on routine. So any opportunity to maintain family norms can be really helpful for them in their coping. And anytime that you know that the norms or routine cannot be maintained, I highly encourage that you share that with your children so that they can be prepared. I also encourage you just keeping an eye out for behavioral changes in your child. As we know, anything in their world that changes can then have a result on them and their behavior. So just keep an eye out to make sure that they're coping okay. I also encourage you to reach out to a provider, connect with us at Crossroads for Hope, or reach out to your care team to set up support for your child if you feel like they're in need of it. With their awareness, I do suggest that you inform the other adults in their life what is going on in your family. And I do this for a couple of reasons. So one is so that you have people that are spending time with your children, keeping an eye out for any behavioral changes so that they can tell you what's going on and what they're noticing. I also encourage you to do that so that the spaces where your children are spending a large amount of time, they have safe people and safe places in those spaces. So that might look like sharing with daycare or school teachers, or sharing with coaches, anyone who your child spends a lot of time with, and that way they know that they're safe people. But I do encourage that you inform your children if you are sharing with these people. This allows your children to be involved in that decision of how they may want those people to interact. For example, some kids may say it's okay if their teacher knows, but they don't want their teacher to say anything to them. They just want to be treated as they normally would. And that's completely normal and typical, but you want to make sure that you're getting that information from your child so that they have some control over the situation. In addition, I really encourage you to keep them involved as much as possible in your cancer treatment and experiences. So sharing with them where you're going for treatment, sharing with them what it looks like there, sharing what doctors you spoke to. And this can help them feel like they're informed and help them feel like they're a part of your experience. And that's great for their coping. So with that being said, as I mentioned earlier, please reach out if you feel like you need continued support or your children are in need of support. Please reach out to us at Crossroads for Hope, the Resource Center at Summit Health Cares, or your existing care team, support team. I will say though, the first step in supporting your children is watching this video. So you are doing the very best you can, and this is just the beginning of it. So thank you for spending the time with me.